Let's go now to Sharon to hear her story. I'll turn it over to you now, Sharon.
Thank you very much, Carrie. I do want to say I really appreciate Dr. Leonard's presentation and agree with pretty much everything he said. I think he's doing, and I have never met him, but I think he's doing an amazing job for us. I got involved with functional medicine when my daughter became ill her first year of college. She came home after her freshman year and was very ill. She was diagnosed by psychiatrists with bipolar, inattentive ADHD, and post-traumatic stress disorder, which was very strange to us because she really hadn't had any trauma. We took her to 22 different doctors. She was put on 9 different psychiatric medications. She gained 30 pounds because of the medications. She lost 30 pounds, and she was just a mess. And it was before the Affordable Care Act passed, so she had to stay in school to be able to stay on our insurance. It was a very difficult time for our family. I finally started to learn that nutrition might help the brain, and I was pointed to a naturopathic doctor at Bastyr University in Seattle, where we were living at the time. And he figured out that she had multiple food allergies. She had celiac disease. She had Hashimoto's that she was able to reverse eventually with a gluten-free diet. And she had just a deficiency in so many things. And he actually was able to replace what she was on 3 psychiatric medications when she started to see him. And he was able to replace what the drugs were doing with nutrients and get her so she was functional again. And she went back to her 4-year college after an absence and got her PhD in biochemical and molecular nutrition, and now works for a biotech company up in Seaport here in Boston. So it was a very, very dramatic difference that we saw, and it really made me believe in nutrition and naturopathic and functional medicines. I really think that it's, as Dr. Lenhart said, it's not just one kind of medicine or the other, allopathic, I call it conventional medicine versus functional medicine. But I really would like to see providers working together with a really big box of tools to help all of us. You know, it doesn't matter what our problem is, but I find in the ME/CFS patients I know so many times, you know, they've had normal test results. The doctors are used to this big differential diagnosis problem, and then where they find where you fit in the grid, and then they find the drug that applies to that condition. And it just doesn't work that way in such a complex disease. On my journey, which has been over the last 7 years, I have seen both MDs who are functional medicine doctors, as well as naturopathic doctors and a couple of DOs. So, and then chiropractors can also do functional medicine, and nurse practitioners. So I have found it's not so important which initials the doctor has, but it's the type of thinking that they have. You know, particularly, I've heard so many wonderful stories from MDs like Dr. Lenhart, who really knew that there was more that was needed for them to be able to help their patients. And I really applaud the efforts of Dr. Lenhart to do this. I currently see here a functional medicine MD here in Massachusetts who is a board certified OBGYN, and she too felt there was more she could be doing and went to the West Coast and got a lot of education. I find doctors who are educated from the system, the Institute for Functional Medicine, as Dr. Lenhart was quoting, are really the best. And then as far as naturopathic doctors, I find that doctors from Bastyr University, and there are some here in Massachusetts, have been tremendously helpful to me, but there are others as well. For my case of ME/CFS, I wanted to give you a little bit of an idea of how I've used functional versus conventional medicine, to a little bit of a contrast. Originally, when I got ill, I went to 12 different MDs, and they just were not helpful at all. They, a couple of them wanted to send me to a pain clinic, and I said, I'm not in pain because I really don't have the fibromyalgia part. But I was sleeping 16 hours a day. I couldn't see straight. I couldn't read anything and comprehend anything. And I was just tremendously ill. So while I was trying the MDs to try to get help, I was seeing a naturopathic doctor, the same one that my daughter had seen, and he started to run tests and find problems. And so I wanted to go through the list of problems that were found, just to illustrate how complex ME/CFS is. And I'll tell you how much help I got from functional versus allopathic doctors. I have Hashimoto's and low T3 syndrome. So that was functional medicine doctors helped me with that. I'm celiac, so no gluten. That's functional medicine and helped me with that. I've got low hormones, DHEA, testosterone. Functional medicine doctor helped with that. The functional medicine kind of approach wasn't as, and the treatments, the natural treatments weren't as helpful with the viruses that I had, like Epstein-Barr, HHV6 cytomegalovirus. So I really needed allopathic, the traditional drugs to be able to get help. I used antibiotics for 2 atypical pneumonias I had. I use an allopathic approach. I get gamma globulins for immunodeficiency. I've used functional and conventional medicine for autoimmune POTS and mast cell activation. I wasn't able to take Mestinon, the main drug for POTS, so I found a supplement that pretty much has the same function, and it's cheap and it's working well for me. I had a lot of nutritional deficiencies, so functional medicine helped with that. I also had, it's a nutrient deficiency, a biochemical deficiency, but somebody made a drug out of it a few years ago. So I'm now prescribed that drug, Kuvan, which is helping me tremendously with my energy. Hypercoagulation, I've used allopathic medicine for that. And I got mitochondrial dysfunction. I've been to conventional doctors who've been unhelpful with it. They recognize I have it, but I've used a functional medicine approach with nutrients to really help that. And then I had a little bit of mold toxicity, which conventional medicine really doesn't recognize too much. And I got help from functional medicine. So it's really been a great approach for my ME/CFS. In my personal life, my husband was recently diagnosed with cancer. We're dealing with a major Boston premier institution. It's a not so survivable cancer. So we've done a lot of research on chemo, radiation, surgery, and then a lot of alternatives that can increase survival and have better outcomes. One of them is high dose intravenous vitamin C. There is a lot of research, and it's got evidence behind it, but this institution told us that there was no way that they could possibly give something as simple as vitamin C to my husband. So we are looking at going back to Seattle, where we see MDs and naturopathic doctors practicing together and combining the best of allopathic and functional medicine. But I really feel it's not a black and white thing. It's figuring out the root causes, figuring out the problems, and then patiently going through and fixing them. And it's just been a very powerful approach. Thank you.
Thank you, Sharon, for sharing your experience. I'm sure our audience found it helpful to hear what you've done and some of the tips you've shared. And I'm so sorry to hear about your husband as well.
Well, just part of life, just like ME/CFS.
Yeah.